We have a technology, the CAT scan 3D, um, which is gives us exact measurement of the bone. After diagnosis that the quality of bone is good, we extract the tooth and we place. It's called immediate implant. We're customizing the space from where we extracted the tooth according to the size of the implant and place the implant in same day.
A lots of people have the question about, let's take implants. And generally, and still very widely proclaimed by dentists, is there's the normal type of implant you do. Forget about which ceramic you put on, but it takes weeks, even months, to so to say do the implant. You first put the screw in it, and then much later you put actually the tooth on it. There's this called one-day implants. And for most of us people, uh, at this time working with iPhones where everything is instantaneously, this sounds very exciting. Is it exciting? Give us your take on the difference between those two procedures, and when maybe one is wrong and maybe one is fitting, the pros and cons of both of them, if you don't mind.
Yes, of
Your
course.
your take, not the medical, not the dental association take. Your take.
Yes, we deal with it on a daily basis. Patients comes and there is a broken tooth that we have to remove, and the patient then asks, "Then what? I can't live like that." And of course, we say, "Of course not," but it depends on the quality of the bone or on height and width. Again, we have a technology, the CAT scan 3D, um, which is takes measurement. It gives us exact measurement of the bone. We have this technology in office. It's panoramic X-ray machine, but it's very specific. So after diagnosis that the quality of bone is good, we extract the tooth and we place. It's called immediate implant. We're customizing the space from where we extracted the tooth according to the size of the implant and place the implant in same day. Uh, and, and if the quality of the bone and medical history of the patient allows us, we restore this implant with the temporary crown. Possible. Nowadays it's possible. But again, it's all depends on medical history of the patient, compliance of the patient, and quality of the bone.
Okay.
Whatever was miracle 10 years ago, got today, it's possible, and we successfully doing those procedures. So for patients, the beauty is that it's one-time healing. You don't come 3, 4 times for the same procedure. You don't take antibiotics 3, 4 times. You don't get cut 3, 4 times and healing 3, 4 times. It's only one time you come for extraction, and temporary crown. And then again, in 3 months, we suggest to change the temporary crown into the permanent.
Got it. Okay. But you look pretty good right away, and good. So there is a need and a use for immediate or one-day implants. They're not a hoax. They're not something you should stay away from.
No, no, no. It's real. It's works, and it has amazing results.
And if for some reason, as you kind of mentioned, it isn't suitable, the dentist will know and he will let you know.
Absolutely. That's why we at the interview when we meet the patient first time, we interview patient. We ask your medical history, if there was any surgeries, if there is hip replacement, if you maybe need to be premedicated with antibiotics, if there is any history of cancers or other medical issues. Diabetes is not a good, uncontrolled diabetes is not a great thing for implants. And also smoking also is a very high risk factor for implant failure, unfortunately.
Is that implants, whether those are the, so to say, I just give it a name, the old-fashioned implant, which takes a long time, or only for the immediate implant or just period implants. That's just for implants. Not everybody is qualified. Is that what you just said?
It's for implants in general. There is qualified patients and non-qualified patients.
Okay,
The
I got it.
major risk factors for implant failure is
Right.
uncontrolled diabetes and smoking.
Okay, I got it. Yeah, but so the about the instant implant or the normal implant, whatever reasons there are, which one the instant implant might not work, the dentist will tell the patient. He will know why
Yeah,
it does not work.
that's why we collect information before
Yeah.
we do any procedure. We interview patients about their habits, like smoking is a bad
Mhm.
about their regular
Sure.
habits, about their diet. We try to correct diet right away on the spot because sometimes patients come and they are high risk for cavities. We try to find the cause why. Not only treating the cavity, but it's also changing the diet, what causes cavities or what causing periodontal disease. So we're trying to find the root of the problem. And before any procedure, you will be interviewed and qualified. You will be told if you are qualified for that procedure, let it be implants or gum treatment or any type of, or even extraction. Some patients are on blood thinners and we cannot do extractions on the same day because we
Sure.
have to consult with medical professional. They have to have